This is the June 2023 TouchWorks Education. We have a few new orders this month. The SIU only psychotherapy referral, psych department use only. This will only be used internally by the SIU psych department. The SIU only peds immunology referral. This order will be utilized to refer to outside facilities only. The following new orders should be used when an SIU cardiologist is going to read the results. The SIU only cardiac MRI, SIU cardiologist to read, and the SIU only cardiac CT, SIU cardiologist to read. These orders are now available in TouchWorks. They were previously included in our April education, but availability was delayed by Springfield Memorial Hospital approvals process. DMH Mobile Cardiac Outpatient Telemetry, MCOT, the results will interface to TouchWorks. And in the Med Admin tab, we have added Novachar 1.5 centimeter by 2.5 centimeter external sheet. We do have a few order changes this month. The Sacroiliac SI joint injection with fluoroscopy will no longer autocomplete when the order becomes active. The order should be completed when results are received or verified. In the change status, we've added temporary deferral to that option. We've added future appointment as a selectable reason. As of May 19th, 2023, the SIU OB Andrology Lab and the SIU OB REI Lab will no longer perform the post-vasectomy semen analysis. An ANA titer MMC, this order has been set to interface only. The RH-Geno, new lab test that will be an interface only test. This is a reflex in the blood bank based on the ABO-RH results. The Lyme reflex will also be an interface only test, and it's a reflex order that will be added on by ARUP reference lab based on results of a Lyme antibody test. The abuse screen MMC has been renamed to urine toxicology screen MMC. The XR esophagus single contrast, swallow and barium have been added as keywords when searching for that test. The head up tilt test, or the HUT, is now available under the procedures tab and does indicate NPO 6 hours prior to test. That has been added to the patient instructions on that order. The Nuclear Medicine Cardiology Resting Thallium Viability Study, SC Cardio Only, has been renamed to the Nuclear Med Cardiology Resting Thallium Viability Study per protocol, and the same with the Stress Thallium Viability Study. It has been updated to be per protocol. PSA Only has been renamed as PSA Diagnostic, and the CMP, BMP, and lipid orders, the patient fasting required question is no longer a required question, and the patient instructions have been removed from that order. We did add a new pharmacy available in TouchWorks. It's CoAssist in Orlando, Florida, and you can see the address, phone, and fax number there. We do have a flow sheet update. The HPV high risk screen will map to the SIU only preventative care flow sheet. This is a result that is received from the St. John's lab that will map to the flow sheet. A PAP result will still need to be manually entered into the flow sheet due to them coming over as a reviewed document and not a verify result. In addition to the SIU only ENT flow sheet, this is a flow sheet that's available under SIU SUR otolaryngology and SIU otolaryngology. A new item has been added to the flow sheet for the UAS, which is the Urticaria Activity Score, and this will only be used by SIU ENT. We do have some note changes. So the SIU results note, we added your colon cancer screening with fecal DNA test, Cologuard, is normal, and we removed your colon cancer screening with Hemoccult card /FIT is abnormal. The SIU informed consent note form has been updated to include verbal parental consent given by a parent. This should be selected when care has been provided to a minor without the presence of the parent and verbal consent from the parent has been obtained. So you can see here we've added verbal parental consent to treatment, referral, or in-office procedure. In addition, we have some V11 note naming convention changes. The clinical informatics staff has been working to update the naming convention of all of our SIU V11 notes. You'll see that some note names have been updated to reflect visit at the end of the note name. This indicates notes that are used for billing purposes or attached to a billable encounter. And some have been updated to note at the end of the name to reflect notes that are used for non-billable encounters. This change will assist us in our analytics and allow us to quickly identify billable versus non-billable visits when needed. Unstructured document changes. Patient letter and letter, the ownership has been updated to a level of 9. And the following unstructured documents will be removed from TouchWorks. Please review this crosswalk for the correct document to be used going forward. If you have any questions about that, please reach out to your clinical informatics nurse. TouchWorks site selection. We've updated the naming convention to ensure that the TouchWorks printer sites that are no longer in use are properly identified. In addition, we've moved these sites to the bottom of the list. Please do not select any sites listed as do not use inactive as shown in the screenshot here. Any work list that may have these sites associated will not be impacted. Regarding our patient safety issue, regarding codeine derivative, there is a safety issue with DUR checking an allergy update for codeine and morphine derivatives. When a patient has a documented allergen of codeine derivative or morphine derivative, the system will not trigger a DUR warning within TouchWorks when prescribing a medication that contains a derivative. Prescribing providers should review all patient allergens before prescribing this class of medication, and the allergy codeine derivative and or morphine derivative should be updated to the specific medication that the patient had the reaction to. This is not a flaw in the system. It was a change made by Metaspan, and it is working as designed. So to ensure the safety of all of our patients, please follow those above actions. We had a few code changes and added ads this month. And then we do have our June 2023 helpful hints. So just a helpful hint on performing location, be sure to select the OCI, MRI, and imaging. That location should be used when ordering an MRI or other imaging at the Orthopedic Center of Illinois. If you don't select the appropriate location, OCI will then call and a new order will have to be entered for the OCI interface. When CCing a note to a referring provider or primary care, we've received information from multiple referring providers and primary care providers that are not receiving a copy of the office visit note when the patient is being seen by SIU. Please remember to CC your note to the referring provider or primary care physician and see the attached job aid for the correct workflow. Upload patient document. This is something that we have discovered a system limitation. So any document that is added utilizing the upload patient document feature in TouchWorks, it will not be sent to the My Health at SIU Medicine patient portal. If you want that document to be sent to the patient portal, it will need to be added to the chart using the TouchWorks scanning process. Controlled substance agreement. Since the date was removed from the controlled substance agreement, we will no longer be attaching them to the old agreement when scanned into TouchWorks. When looking for the controlled substance agreement document in TouchWorks, please be sure you're looking for the most recent date. PHQ-2 questions and results should be recorded in the SIU Adult Vitals panel. If it is an encounter in which vitals are not taken, then the results should be recorded utilizing a PHQ note form or a PHQ order. And one final change is regarding a new modifier JZ, which is effective on July 1st, but we wanted to make you aware ahead of time. This is CMS is requiring this new modifier, JZ, which is a zero drug amount discarded, not administered to any patient, to be appended to drug codes for your practice's Medicare Part B drug claims in 2023 to indicate when there were no discarded amounts for a single dose container. And all of the details are included here about that. If you have any questions, please reach out to your coders within the department, or Patient Business Services would be able to assist you with that as well. Thank you for watching our video and have a great day.